A skin prick test. A skin prick test is a diagnostic test to identify allergens responsible for triggering symptoms in allergic disease such as asthma, hay fever, or allergic rhinitis, eczema, etc. A skin test is cheap, rapid, accurate. It can be done in less than an hour. It is safe and can be performed in all ages. Adverse generalized reactions are extremely rare. So results of skin prick test can be used in management of patients in treatment. For example, we plan desensitization to certain allergens by vaccine, removal of family pet, removal of carpet, avoidance of certain food, etc. So for preparation, patients should be advised not to take antihistamine 72 hours prior to the test. For procedure, so we need to get information first from the doctor or the patient to determine which allergen to use in testing. Test is usually done in the inner forearm or at the back. We administer the test and then we review the patient's reactions. So first we clean the site with alcohol, mark the skin about 2 centimeters apart from each other, place a drop of allergens and next to each mark, prick the skin through the drop. Use a new lancet or needle for each drop. So we use some allergens like house dust mites, ragweed, tree pollen, pits, cockroach, mold, occupational protein allergen, etc. And beside this, we should use a positive like histamine and negative control like glycerosaline control to exclude false positive and false negative reactions. So once the test is done, we wait for about 15 to 20 minutes for the reactions. So positive control or histamine normally gets itchy in a few minutes, then red, swollen with a wheal, but negative control usually show no response. So we use positive like histamine. This will provide us information about patient ability to react and if their ability is being impaired by use of drug or antihistamines. But all adults normally should exhibit 7 to 10 millimeter of wheal after histamine administration. But the negative control in most patients do not cause any reactions. If they do have reactions, because they have very sensitive skin, so result needs to be interpreted cautiously. So here are the interpretations. A wheal of less than 4 millimeter is negative. 5 to 7 is 2 plus, mildly sensitive. 7 to 10, 3 plus, moderately sensitive. And more than 10 is 4 plus, very sensitive. All readings should be always made against positive and negative control. Some common errors. Tests should not be too close to each other. Bleeding induction can cause false positive results. Insufficient penetration results false negative, and spreading of allergens during the test. These are the common errors. Factors that affecting skin test result is first quality of allergens, second area of the body, for example wrist or least reactive, age, less reaction after age of 50, and short-acting antihistamine inhibits the wheel for up to 24 hours and long-acting antihistamine for up to 4 to 5 days. So we better ask patient not to take any antihistamine for 5 days, up to 5 days prior to the test. So in conclusions, skin prick tests serve as additional informations in identifying causative allergen in patients with allergic disorder. Okay, so for the skin test, we're using the disposable multiple applicator. So we remove it from the container. It has 8 heads for 8 different reagents that can be filled with. So it can be positioned only in one way. So I'll put it here, dip it in, and then I will choose my side, this hand, and clean it with alcohol. Mostly we use the 4R with no hair, because in hairy places you will have problem with for interpretation. Clean the side nicely, and then we'll write the number 2 centimeters apart. 1, 2, 3, 4, 5, 6, 7, 8. Now I'll put it for 2 seconds. I'll have to apply uniform pressure to get good penetration. Sorry, is it hurting you? Not so much. Okay, and then we'll remove it and we'll leave the skin for 15 to 20 minutes for any reaction. We have our control, which is histamine, positive and negative, also in order to be able to interpret the reaction. Plus we have other reagent as well. So in 15 minutes we will look at the reaction. Okay, so now after 15 or 20 minutes, now we see the results. So number 1 is our control, which by size we can see is 7 millimeters. For histamine, this is a normal reaction, 7 to 10. But for the rest, for the control, it's interesting to see it is 5. This is also 5. For control, we're not supposed to have any reactions for the negative. So if we do have reactions and they're all similar, that is telling us that this is not positive. This is a negative test, because all of them have the same size as negative, our control, which is a mechanical reaction with our instrument. There is no chemical reaction. If it is more than 5, more than our negative, then we will consider positive, but this is equal to negative. And the histamine is 7, which tell us that patient is able to react. His reaction is not impaired by any medication or any histamine, etc. So this is it.